Hi, everyone. Welcome back to another episode of Ascend TV. I'm your host, Dr. Leslie Cadet, the founder of Ascend Occupational Medicine Consulting, where we help self-insured employers lower their workers' compensation costs. In today's episode, we're going to be talking about inhalation injuries. And I always like to go over cases that we've helped clients with so that we can demonstrate the cost savings that we're able to get for the client. And a lot of these results are reproducible because we see a lot of the same patterns in the cases where, for whatever reason, the treating provider is not able to bring the case to a close within a reasonable time frame. And a lot of times it's just because the treating provider isn't paying attention to the timelines. And so we're going to talk about how that costs your organization millions of dollars and how you can correct it. So in this case, we have a 63-year-old female. She's a registered nurse. And the mechanism of injury is that a MRI machine overheated, and the technicians opened the door to the examination area, allowing smoke and chemicals into the CT bay area, which is where our nurse was. And so she was initially evaluated for cough and shortness of breath. Her chest x-ray was normal. She was diagnosed with toxic effect of smoke and prescribed an inhaler along with prednisolone. So over the next few months, her symptoms continued. She was also found to have a non-industrial COVID infection that she had come down with shortly after being exposed to this chemical inhalation. So later on, she finally got a CT of the chest, and that CT showed some air trapping consistent with COPD. Her pulmonary function tests were still pending. She was also referred to pulmonology, right? And so this type of injury, if you inhale some noxious chemicals for just a few minutes, that type of injury, we would expect you to be fully recovered within 2 weeks. And the projected cost for this type of claim is roughly $1,500. So, where are we getting these stats from? How do we know how long the timelines of recovery are? How do we know what the projected costs are? Well, insurance companies, bless their hearts, they collect data from millions of patient encounters, and from that data, we're able to derive how long a certain injury should take to get better from. And we can also see how much the insurance companies have paid for those types of claims, and that's how we get this information. So in this particular case, you know how it is. You order something for a patient in workers' comp. For whatever reason, it can take a billion years, especially if nobody is tracking it and saying, hey, I ordered this last week. What's going on with it? A lot of times nobody's following up on the orders until 3 weeks, 4 weeks, 6 weeks later when you're seeing the patient again in clinic and you're frantically running around trying to see, well, what's the status of that order, right? It should have been tracked in the days following the placement of the order. I digress. In this case, the claim was open for 3 months and the cost skyrocketed to over $20,000. And so one has to ask ourselves, well, if we thought this was only going to take 2 weeks and it was only going to cost us $1,500, why is it taking so much longer? And why is it 20 times more expensive than we thought it was going to be? And in this case, we need aggressive case management. That means we have to really be trying to say, hey, how can I get this patient in with pulmonology sooner? Hey, this patient has a non-industrial COVID infection. So at this point, is she still coughing because of COVID, or is she coughing because of the original injury? And so a lot of that can be teased out when we get the PFTs, when we get the CT of the chest, right? And so in this case, our recommendation to our client was that if the CT of the chest and her PFTs came back without any type of industrial pathology, she would need to be discharged back to her primary care provider, right? We would remove the restrictions because it's not an industrial injury and send her back to her PCP so that they can take care of her COVID-related sequela. But if the CT of the chest and the PFTs are found to be industrially abnormal, then we would recommend that she do some type of pulmonary rehab. And if that's not getting her better after about 6 months of this, then go ahead and declare her at maximum medical improvement and discharge her with permanent restrictions, whatever those may be that are appropriate, and provide future medical so that she can continue to see pulmonology. So when we talk about closing claims faster, we're not saying boot the patient out before their medical treatment is complete. We're saying track your cases tightly, and when the industrial portion is over, send the patient to their primary care physician so that they can continue to get the care that they need. Don't keep them tethered to the workers' comp system, which we know is very inefficient, and keep running up the bill unnecessarily. So if you had 10 cases like this in a month, the cost would cost the employer over $200,000. And if you did that every month for a year, that's $2.4 million. Now, how often does an MRI machine start smoking? I would gather to say not very often. But if it's not a smoking MRI machine, then maybe it's a reactive airway disease from working in a cold freezer. Or maybe there's some other industrial chemical that's being inhaled on a regular basis and fit testing hasn't been done correctly, or the patient isn't wearing the appropriate PPE, and so we're inhaling dust and other things that can cause airway irritation and shortness of breath. So whatever your inhalation injury picture looks like in your organization, put it in the blank. Okay. And you can see how these types of claims can become very expensive, right? So again, how much is it worth if you are a self-insured employer and you've got a group of providers that are responsible for caring for your employees, and they're not tracking how long it's taking to move the patient through the expected timeline of recovery? There's nobody that's tracking the referrals. There's nobody that is helping the patient get seen sooner by a specialist. How much is it worth to give your providers additional training on managing the timeline of recovery, of giving them additional resources to help them with their case management, right? We just saw if you don't do that, you could easily be spending $2.4 million a year, if not more. How much is it worth to have tighter case oversight, right? Because if we're just putting in orders and then sitting back and waiting for the next follow-up appointment before we say, oh, wait, nothing that I ordered in the first appointment has been completed, and here we are on the second appointment, this isn't moving forward. How much is it worth to have someone help you have tighter oversight of your cases? So if that's something that your organization is struggling with and you need assistance, Ascend would love to help you. I have some more information regarding that in the show notes. But until next time, bye.